My name is Dr James Howarth and I'm a GP in Lincolnshire. I'm here today to talk about testicular cancer. Testicles, balls, nuts, rocks, bollocks, ghoulies, nads, knackers, family jewels. Call them what you want, but half of us have got them, and like every other part of the body, they can be vulnerable to cancer. Testicular cancer is a little unusual because unlike the majority of cancers, it mostly affects young men in the 15 to 45-year-old range with a peak in the early 30s. It's not the commonest cancer, but it's common enough. 6 cases are diagnosed every day in the UK, and the lifetime risk is about 1 in 400 for all men. We don't know the exact cause or causes of testicular cancer, but we do know a few factors which increase the risk of developing it. These include a family history, which means cases or a case in your direct family. Also, having had previous testicular cancer, that's because someone who has had cancer in one testicle is much more likely to develop it in the remaining one for a few years after, which is why patients are followed up for 5 to 10 years by a specialist. So should we worry? Well, it's more a case of being aware. Here's the good news. Testicular cancer is very treatable if found early, and the outlook is one of the best for all cancers. 90% of all cases are alive at 10 years and effectively cured. Treatment is usually fairly simple surgery, sometimes with follow-on chemotherapy. One testicle is removed and there's an option of having an artificial testicle, but these are so realistic it's difficult to tell the difference. The remaining testicle will still function. It doesn't usually affect fertility or the ability to have sex. So, a very treatable cancer? Absolutely, but only if found early, and that's where you can help yourself. Testicular cancers are usually found when a man notices a lump, swelling or an unusual firmness in one of his testicles, or sometimes a persistent ache or pain. So it's very important that you examine your testicles regularly so you know what they feel like and can be aware of any change. Checking yourself out in a warm bath or shower once a month is probably enough. If you're then worried, contact your GP practice. They'll examine you, and if they're concerned, refer you on for an urgent appointment or scan. Of course, people can be very embarrassed about showing their privates to the healthcare professionals, but rest assured, it won't be the first time I've examined someone's testicles that month, even that week. Any abnormality probably isn't cancer, but if it is, it's really important to seek help early. Now, I've mentioned how treatment is very effective, but it does become less so the longer it's left, as the cancer may spread and become much more difficult to treat. So, to sum up, testicular cancer is very treatable, but only if it's found early, so get into the habit of self-examination and speak to your GP practice if you notice any change in your testicles.